Good evening, everyone. I'd like to welcome you to this evening's webinar. We're just going to give some of our attendees a little bit more time to log in. We have several hundred people signed up for tonight's webinar, so we're going to be getting started in about 60 seconds or so. Again, good evening, everyone. I'd like to welcome you to tonight's webinar. We're going to be getting started in about 30 seconds or so. We're just allowing some more people to log on. We're just about the top of the hour, and we're just going to get just another few minutes, another few seconds till we're going to get started. All right, good evening, everyone. I'd like to welcome you to tonight's webinar. As always, these webinars are being presented on behalf of NEMO Healthcare. My name is Dr. Alan Bass, and I am the Senior Consultant for NEMO Healthcare Consulting. And tonight's webinar is something that I've been pretty excited about. I've been watching the development of our new TRAKnet patient portal. We had developed this portal with a lot of feedback from our users, and we're going to be releasing it this week. And I just wanted to take tonight to start showing you some of the preliminary features that we're going to have. I think are some of the best features that we have, and we're going to have more and more releases coming up with additional features in there. So let's just jump right into tonight's webinar. So tonight's webinar is definitely being recorded. All listeners are in a listen-only mode because there are several hundred of you. I am not going to be taking any questions directly this evening. I'm going to gather all the questions. Some of them might be duplicated, so I'm going to get them all together and answer them all and have them all distributed to all the attendees tonight. So please don't be upset if I don't get to answering questions this evening. Let's just jump right in, and I'm going to show you exactly how we're going to go about setting up our portal and then what it's going to look like and some of the features that it's going to be. As you can see, we're logged into TRAKnet 3.1, and if you notice in the upper right-hand corner, we're just using a setup screen for tonight's webinar. For some of the screenshots, you'll see a little later on that we're actually going to be in my database showing you how some of the other things are functioning. In order to start using the portal, it definitely needs to be set up. This is just not something that's going to be ready to go. So I want to just take everybody through the steps that are going to be needed once the portal is released. In the upper left-hand corner of your screen, you'll notice that there is a Practice Portal button. And once you drop down, you're going to see the portal setup right there. Once you click on that portal setup, you're going to see this practice setup screen come up, and then you're going to click on the direct setup button right there. Once you click on that direct setup button, you're going to see the practice setup screen pop up. Now, the first thing you're going to need to do is place the name of your practice there. If you go by your own name for the practice, whatever it might be, that's going to be something that you're going to choose. For myself, I use Bass Podiatry in my private practice, and that's what I placed right there. And then you're going to click Save. Once you do that, you're going to then start some additional setup. You're going to go back to that direct setup, and then this direct user is going to be popping up in front of you. The most important thing that I really want to make sure everybody understands is that the user setting up the portal must be a provider and must be logged in as the provider. That is the most important thing, because this is being done via a provider's NPI number. When they have to go through a process to be checked or vetted. You'll see that in just a few minutes. That needs to be done by the provider who is the logged on user. Then the DPM is going to choose their name from the user drop down right in the center of your screen there. And only one of the providers, if you have multiple providers, initiates the actual setup of the portal. Okay? You can put anything you want under the username. There's no spaces. It should appear exactly how you want it to seem when the patient is logging in to view your portal. So anything you want goes under that username. Just make sure there are no spaces. And when the patients log in, they're going to see what the username is when they are logging into the portal. You're going to see there that NEMO setup is the person that is the logged in user. So they're going to go right there into that user field. And then again, you can put anything you want. We put the username of Dr. Portal underneath the username. And then you're going to make sure you check off the boxes for direct active, the administrator, since the user is the one who's setting up. They're going to be the administrator. And most importantly, do you want your name listed in the provider directory? Now remember, you're going to need to have an email that is going to be used for the direct communication through the portal with other providers. So do you want your name listed in this provider directory for other providers to be able to email you directly and securely through the portal? But you can choose whether or not you want your name listed in that provider directory. You see there that it then lists you as the user, and then you're going to click on that direct setup button again. And now you're going to have to go through a vetting process. So you're going to see that this was what you typed in to the box back when we did on slide 4. And you'll be able to go back and reference those slides once we distribute this and once you can review this webinar again on your own. Now, it's very important that you actually have to go through a process in order to be allowed to use the patient portal. It's not just something you have access to, but it is the most secure portal that we can find, and you actually need to be vetted in order to be able to use our patient portal. So you're going to click on that vetting process button, and then what's going to happen is you're going to have to be vetted. You're going to go through a series of steps, and you're going to put in some information. But what is very important, because the company that we have contracted with called UpDocs, they will make sure that the information that you put in is exactly the information and is what needs to be done. When they vet you, they're going to look actually at the credit bureaus. So if for whatever reason you have a freeze on your credit bureau accounts through Experian, please make certain to release that hold during this vetting process. It's a very quick process. It is something that you can release any holds that you have on your credit for just a short period of time, even for 24 hours, that would allow UpDocs to vet the information that you are putting in to check that you are who you are. You're going to come to this screen. You're going to just read this and click in the bottom right. You're going to click accept. You can see that right there. I just brought it up to the top of the screen there. Once you do that, you then are going to put some information in. And you can see that your name, your practice name, is going to pre-populate right there. One of the so you're going to fill in all of this information, but what you'll notice on the right-hand side is it checks whether or not the information that you've put in, some of the information it checks right away, some of the information you're going to actually get a code. So you're going to fill in your business name, and your practice name is going to populate there. You're going to put in your first name, last name. Those are required. This will be your home address, not your practice address, because UpDocs is checking to see you are who you are. You're going to put in your home address, your date of birth, and your email address. Your email address does not have to be your personal email address. That can be a business email address. Further on down the screen, and since we just took screenshots, I'm just going to flip it down. You're going to see you are then going to put in your individual NPI number. You are then going to put in your personal phone number. And then what is going to happen is once you get a call, you're going to fill in your phone number. And when you put in the phone number, you're going to see that it's going to want to call you and provide you with a confirmation code. Once you get that confirmation code, you're going to fill it in there. It's going to actually call you. You can actually utilize your cell phone for them to give you that personal call. And you're going to see that now on the right-hand side, what was the right-hand side of the screen, all the information now is ready to be submitted once you put in all of that information. And then you're going to click on Verify Identity. Once you click on Verifying Identity, you're going to see that you have now been vetted and you are now registered with what we call the Direct Trust Network. And you are ready to you are now a verified user within the patient portal. These are things that you need to do just for you to set up the portal. It may seem tedious to you, but it is not. It's actually a very quick process that you're going to go through and put this information in. The most important thing I, again, would like to stress is making certain that there is no credit hold by Experian, because that will prevent you from being vetted through UpDocs. Once you've done that, you're going to be able to start working. So you can see when you get to the practice, you're going to go back into TRAKnet, and now you're going to be able to go into the secure messages inbox. I want to show you just a little bit about our portal once you log in and some of the different things that you have here. Your mailbox, when you're logged in as the user, your mailbox is for direct messaging between providers. Only providers with a direct email have access to this tab. Remember, we said the direct email was associated with your NPI number. Any non-DPMs can sign up. Your staff can utilize the portal, but they would not have access to the mailbox icon. They'll have access to secure messages and forms, and we'll talk about secure messages in a moment, but they will not be able to have access to the mailbox where you, as the provider, may receive a CCDA sent by another provider through the direct email. Okay? This must, so again, the mailbox must be a provider. The provider is the only one that's going to have access to that mailbox. Now, secure messages, those are between the provider and the patient. If you're a non-provider, one of the staff members, you can have access to this, to the secure message, and receive messages from the patient. You'll see in the secure messages, patients will be able to request appointments. They will show up in that secure messages box. You will be able to mark that appointment request approved or denied. That will automatically send a message back to the patient's portal, which is where the message originated from. So remember, they are communicating securely to you. So the message they sent you is coming directly from their portal. So any request or any message, appointment requests or messages that they send to you will be sent back to their portal, not to an email, not to a generic email, but to that secure email address. If you approve that appointment will not load into the appointment scheduler. That is something that at this point would need to be done, still be done manually, and we are working towards having it when you approve an appointment through the patient portal, that it will automatically enter into your schedule, but at the moment it still needs to be done as a manual process. Let's talk a little bit about some practice settings that you need to put into TRAKnet. So your address would be defaulted, but what you would need to do is click Edit at the bottom of the screen in order to start editing information within your portal, information that ultimately the patient will see. When you click that edit, you're going to be able to click locate address and click save. The Google map for your practice will be updated and it will show up right there for you. You can see it right there. You also have the ability to edit your office hours and add your practice logo. So when your patient clicks on the web address and goes to your portal, that information is listed right there on the sign-in screen for them to view. Your logo and your hours will show up right there. When you click on patient engagement in a patient's chart, you will also, from the CCDA, from either the patient engagement or from the CCDA, you will be able to send it to the patient. This is where they are going to stop. This is now the new portal. This is replacing Health Vault, and this is where the CCDAs are now going to be sent. The patient will be receiving an email inviting them to the portal. If the patient has already received an invite, you'll only receive the CCDA message that it was sent successfully. So once you send that, they're going to get an email inviting them to then log on to the portal. Remember, that is why you need to continue to get a patient's regular email address, Gmail, whatever it might be, in order for them to then receive the invite, in order for them to be sent to log in and register, for their portal. Patients will receive the email with their username and their temporary password. Okay? They will receive something like this. It'll say, "Welcome to the patient portal. Please use this link." And again, remember earlier in the presentation, we had that test 1 as the name of what's showing up. That's what they're going to see. They'll have their username and a temporary password. Their username will be an email address. Once they log in using that username and password, they'll click on the link, and then they're going to be coming right here. So you'll see that they'll put in their email ID and that temporary password and click log on. Once they do that, the date the patient will first be seen will be that current date. What they need to do is they need to then just change that to their date of birth. Okay? So the first date that shows up there is going to be the date that you send that to the patient, or the current date that they log in to set up their portal will be the date that shows up there. They will then put in their date of birth and click proceed. At that point, and also please remember that they need to put in the slashes for their date of birth, month/day/year. When the patient then clicks proceed, what's going on at that moment is that information is being transmitted back to your TRAKnet database, and it is checking whether or not that information matches up to what is in your database. So if the data they put in their date of birth and you have it incorrect in your TRAKnet database, they will not be able to verify themselves in the portal. So make sure that the patient's date of birth is correct prior to inviting them to the portal, because that is what they are going to use to verify their account. Once the user then logs into their account, this is what they will see. And for the beginning stages of our portal, this is the 3 red arrows are really what I would like to draw your attention to. The visit summary, the requesting of appointments, and payments. While the messages, they will be able to send secure messages that will be under the message tab. The visit summary, the appointments, and the payments are the areas we're going to focus on. Their visit summary, when they click on that tab, will be able to have their CCDAs from any date range that they may have been in to see you, that you have transmitted that CCDA to the portal. They edit the date range, they can download it, they can view it, they can actually forward it to another provider directly from their patient portal. Appointments. The scheduler will be there. They will be able to click and choose an appointment time and send that to you in order to see if you would accept that appointment slot from them. Payments. You are going to be able to have your payments make their payments directly online through a secure way, just like you would be able to do your transactions for your integrated credit card transactions right now through TRAKnet. So just to show you a little bit about how something like this will work, I want to just show you a few of the steps. So in this test patient, what you will see is this patient has a balance of $674 in TRAKnet. In the patient's portal, they will see that amount that comes directly from the TRAKnet database. When they see that, they click on Make a Payment. At that point, the Transaction Express screen will pop up in front of them. This should be a window that's familiar to most of you because this is the window that you see when utilizing your integrated credit card processing through TSYS. They can then put in their credit card number, expiration date, amount, their security code, and their address. Once they put that in, they're going to verify themselves that they're not a robot, and they're going to click Submit. Once they click Submit, they're going to get a receipt very similar to what you would see in TRAKnet when you're doing a credit card transaction in TRAKnet. They could print it or close it, whatever they would like. Just for demonstration purposes here, because we were going back and forth making sure we could show all this to you, you could see here that we have made in this test patient's portal, we have made some dollar payments that a user will then be able to see if they want to search a date range and see what payments have been made. Once those payments have been made, back in TRAKnet, your billing staff could come back into the billing dashboard. They can look at a date range, and by clicking on the patient portal checkbox and clicking refresh, you can see that they will show all of the credit card payments that have been made for your patient that will then be there as an unapplied payment. Then they need to eventually be applied to the patient's ledger. Additionally, you can see that through our testing, you can see that you actually have the ability to remove any payments. This is a screen that shows that you can be on the previous screen and then click on and highlight any of the transactions and click remove, and it will actually reverse. And you can see that these have been our test functionality that allows us to remove that same those same payments. And you can see by clicking on the show deleted, you could see any of the payments that have actually been removed, and the transaction gets done back through TSYS to credit back any amount that you may want to refund back. So what do you need to do to prepare for our portal? For those of our users who use TRAKnet on the cloud, once you perform your update later this week, when we release the portal, most likely Friday, you're going to be all set to go on Monday morning. You're going to go through your setup and you'll be all set to go come Monday. For those of our users who continue to utilize TRAKnet on a server, it's a little bit different, and I really need for everybody who does it this way to pay attention. You're going to still perform the update on your server, but please leave your TRAKnet open the entire weekend. Lock your server, but leave the program open. Because you've chosen to continue to utilize TRAKnet on your own server, a sync needs to happen. So all of the data on your server can actually sync up to your portal. So there is a process that we've put in place that allows your TRAKnet data to sync to the portal for your patients. And that's a lengthy process. So when you do this update on Friday afternoon, leave your TRAKnet program open and lock down the server and let it stay open over the weekend so everything can take place and you'll be ready to go on Monday. In addition to tonight's webinar, our support team is going to be updating the TRAKnet wiki and is going to be producing some short videos for additional training. So if anybody needs it, that'll be available to you later on this week as well. If you have additional questions, please feel free to reach out to our support team on how to use or anything that you're having questions with the use of the portal. I will make certain that this webinar is available for everyone to review again, and I will be gathering the questions and getting those out to everybody who's in attendance this evening as well. I want to thank everybody for joining me this evening. Have a wonderful evening. I think this patient portal is going to be very beneficial to your practice, especially with the patient payments, allowing patients to make payments online. And with that, we will adjourn for the evening. And thank you again for joining me. Have a good evening. Good night.